I know,
Yeah.
me too. I did too because I wasn't sure.
All right. Awesome. Awesome. All right. Good morning, good afternoon, good evening, depending on when and where you are watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinti, CEO, founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, where we help our patients live long and well because we believe the quantity of life is just as important as the quantity of life. I'm excited to be here with you again, discussing another topic on the purpose of helping us live long and well. And today's topic is, Doc, I don't eat sweets, but my sugar levels are high, or something of that sort. And we have with us today the amazing Dr. Rinku Mehra. How are you doing, Doc? Good morning.
I'm doing great. Thank you for having me.
Oh, my pleasure, my pleasure. Now, for those of you who are watching live, hashtag live. For those of you who are watching or will watch a replay, hashtag replay. Feel free to tag people who you or friends, family, loved ones, who you know will benefit from this talks, because of course we're having a talk with an endocrinologist on the topic of diabetes. That being said, Doc, please kindly introduce yourself. Who are you and what do you do?
Sure, of course. So I'm a pediatric endocrinologist. I've been
Okay.
treating children and young adults with both type 1 and type 2 diabetes since my fellowship in 2004. I also treat
Okay.
all types of hormonal issues in children age 0 to 21. And sometimes I see, kids beyond, I call them kids, but I see them in college after they graduate college, and sometimes that can be up to 24. And I'm based in Virginia right now, but I
Okay.
have practiced all over the US, mainly East Coast and Midwest.
Awesome, Doc. I like what you do, and I like the fact that your kid patients don't want to leave you.
Yeah,
They kind of
right,
grow with you. All
right,
right, awesome.
right.
Now my next question to you is, why do you do what you do? What got you into peds endocrine? Like, how did you get? Yeah.
Sure, yeah. So when I was a resident, when I was a medical student, I chose pediatrics because I
Okay.
love working with children. And I find children keep me young, and I love the curiosity that they bring. And they're always wanting to make me learn, and they always, are making me learn in a way that's different. And, I learned how to talk to kids. I think I'm probably just more comfortable talking to kids. And so I chose pediatrics for that reason. Now that I have two kids of my own, I realize, how their brain thinks and how their mind thinks, and really what parents worry about. And so I really enjoy teaching children and the adults, their parents also, about their medical conditions, because it's really confusing. And we always said in medical school and residency that kids are not little adults. And that's very true. They're not little adults. And so I loved pediatrics. Um, I chose to subspecialize in endocrinology because I like the logic of the hormone pathways, and I like to be able to solve the endocrine problems. And I also, like being able to work with children and families over many years. So, endocrinology is an area of the body that deals with the whole body,
Mhm.
not just one organ system. And in pediatric endocrinology, we have the chance to allow kids with hormone conditions to live a normal, healthy life. So, for example, with the discovery of insulin, a patient with type 1 diabetes, who is usually diagnosed in childhood, can live
Right.
a normal, healthy, active life and do anything that they want. Um, Short of, I think, flying an airplane, I think getting a pilot license is restrictive if you have type 1 diabetes, but anything else they want to do, they can do it. Another example is a child who has a thyroid problem. Without it, they can have, lose IQ points and not grow well. And just with the treatment, they can live a normal, healthy life and be quite active. And so I think, it takes years of treatment and a lot of patience, but using these endocrine treatments to guide these patients into a healthy life is really what makes this area satisfying for me.
Awesome. And I love that you also empower the parents to better care for the child as well.
Exactly,
Um,
exactly.
and you help the
Yes,
child reach their maximum potential. You catch these issues before they become
right,
semi-permanent.
right, exactly,
Mhm.
exactly.
Awesome. Awesome. Now, so the topic is, I don't eat sweets, but my sugar is always high. So
Hmm.
we're gonna delve into that. So when someone comes to you and asks that question, like, I don't eat anything sweet. None of the foods I eat actually sweet in taste. What do you typically say to that? Like, why are my sugars high? What would you say to the patient?
Yeah. So, and I'm assuming you're talking about patients with diabetes, right?
Yes, yes,
Okay.
yes, yes.
Yeah. So, patients with diabetes have, a couple of issues going on. One is if we're talking about type 1 diabetes, which is mainly what we see in kids, their body's
Right.
not making insulin. And so our pancreas is usually what makes insulin, and our pancreas does a perfect job actually of regulating our blood sugars. So blood sugars are not just regulated by what you eat. Okay, so blood sugars are regulated by a whole host of other things. I'm going to give you an example. Sunburn. Okay, you go out and lay out in the sun and you have a sunburn. That
Right.
pain causes stress, and stress will increase your blood sugars. If you have a normal functioning pancreas, your pancreas is fantastic. It's a great organ to regulate your blood sugars in times of stress. But if you have diabetes, either type 1 or type 2, and we can talk about that in a little bit, but if you have diabetes, you are trying to do what your pancreas does normally. And we are
Mm.
not as perfect as the pancreas, right? And so our blood sugars are high in times of stress. And you could have eaten nothing, or you could just, being on a keto diet and your blood sugars are high. And the reason is it's stress related. Another example, artificial sweeteners. So more research is needed, but some of the studies do say that they can raise blood sugars. Coffee. So some people are super sensitive to coffee and caffeine, even without sweetener in it, with no sugar. So your blood sugars can rise even with coffee. Um, Lack of sleep. We always talk about sleep in our kids and sleep in adults. You lose even one night of too little sleep, that can make your body use insulin less well when your blood sugars are high. So there's so
Wow.
many things. Some of the nose sprays that you use for allergies, they have chemicals
Right.
that trigger your liver to make more blood sugar, and so your blood sugars are high. Not drinking enough water is another example. So you don't drink enough water, you get dehydrated, your blood sugar is more concentrated, and you have higher blood sugars. Skipping breakfast. So if you say, "Oh, I'm going to skip breakfast today, and I'm not going to, because I don't want any carbs," um, that can trigger higher blood sugars later in the day because of stress, a stress response. So it's really tricky, and your pancreas is really an amazing organ that can regulate blood sugars for you. And with diabetes, either if you take insulin or even if you don't and you take medication, we are not perfect. Your doctor's not perfect. You're not perfect, and you're not going to be perfect as far as regulating every single blood sugar. And the goal is on average to keep your blood sugars within range. And there is that phenomenon of diabetes burnout, which a lot of patients experience because they're not as perfect as the pancreas. But the expectations are that you're not going to be as perfect because there's so many things out of your control. But the thing to do is to
Mhm.
test your blood sugars, before and after certain activities. Exercise is another one. Exercise is a big one that raises your blood sugars. And so the important thing is to test before and after and see how your body
Right.
responds to
Wow.
some of these things. So there's a
Wow.
lot of things that can impact your blood sugars.
So the issue is not always the patient's fault, because patients come to you and they're frustrated.
Yes,
I didn't even eat and my sugar's high. I didn't eat
correct.
anything sweet and my sugar is high.
Yeah, yeah,
I'm doing other things you guys tell me to. I swear calories are within. I mean, I
yeah,
can show you the proof, and sugars are high. It's just the way your body functions is different, and the goal is to keep it within range on average as much as possible.
yeah,
So
yeah.
wow. Okay.
Yeah.
That
And
that
there's
is
a
profound.
great there's a great book. There's a great book called Think Like a Pancreas. And we, sometimes recommend it to our patients. It really talks about, how the pancreas regulates blood sugars. And it, it really is empowering too for patients to understand that. Like we're not able to do everything perfectly that the pancreas does.
Okay. Now that being said, what are ways now when it comes to certain food, and we talk carbs, good carbs versus bad carbs. So
Hmm.
we understand that there's a little more work to be done as far as management of sugars. And so our
Hmm.
patient will partner with you, the endocrinologist partner with their primary care doctor, a nutritionist, the podiatrist, and everybody else. Now,
Hmm.
when it comes to foods, and there's always the talk good carbs versus bad carbs. What do you tell your patients? Like, what can I eat if I have diabetes and I want to do a good job?
Yeah. Okay. So, that's the question on everybody's mind, whether or not you have diabetes or not. What can I eat? What should I eat? Right? There's so much food available. What's the right thing? And you might worry about, having diabetes means that you have to go without food that you enjoy. And that's not true. Okay. So in the past, we used to talk to our patients about, the ADA diet and make sure you eat, within this and this and that. It really isn't that anymore. So even our patients that are diagnosed with type 1 diabetes, sometimes as young as 18 months old, or 15 months old, we have, very young patients with diabetes. The good news is you can eat the foods that you enjoy. You may need to eat smaller portions. You may need to enjoy them less often. And the reality is, ice cream every day is not good for everybody. Okay. Like like your ice cream, but let's focus on having that maybe once a week. And you don't need to have that, every day. So you can talk to a healthcare provider, you can talk to a nutritionist about creating a meal plan that meets your needs and likes. And usually when we have patients, young patients with diabetes diagnosed, we talk to them about what they usually like to eat, what do they enjoy, and then create a meal plan tailored around what they like. If they're taking insulin, the important thing is to count the carbohydrates, and we teach patients how to count carbohydrates and take insulin matched to the carbohydrate, again, because we want to think like a pancreas. That's what the pancreas does. If you eat a piece of candy, and it has 10 grams of sugar, your body's insulin will spit out a little bit of insulin to account for that amount of carb. And that's what we're trying to do, by thinking like a pancreas ourselves. So we want to eat a variety of health food from all different food groups. We want to take the insulin according to the carbs that we eat. Now, for type 2 diabetes, it's similar to, eat what you enjoy, but within moderation. Again, that being said, we're not eating sugary food every single day, not with every single meal. We want to make sure that it fits within our meal plan. For the most part, we want to eat healthy starches, vegetables, fruits, grains. So, you can eat rice, you can eat bread, but we want to pick whole food or whole grain because it takes longer to digest and absorb those foods rather than simple sugars. Okay. And an example of that is you wouldn't just eat a sugar cube, right? Because what that's going to do is like raise your blood sugars, then drop your blood sugars. What you want to do is eat something with whole grain, make sure you have protein at every meal. So lean meat, chicken, turkey without the skin, fish, eggs, nuts and peanuts. And then you can add in, whole wheat bread, whole wheat pasta, oats, cornmeal, brown rice, barley or quinoa, and foods that really sustain your blood sugars longer rather than giving them these big spikes and then big dips in their blood sugar, because that's not what you want. And if even if you don't have diabetes, you don't want to eat that way, because if you eat food that has simple sugars in it, and I always talk about it, if you're just going to eat plain white rice or a plain piece of white bread, that's basically like you're eating a sugar cube. I mean, just pop that sugar cube in your mouth and you're going to see the blood sugar rise and blood sugar drop down. And you don't want to do that. That's going to make you hungrier later, and it's going to add calories that you don't need. So you really want to watch, as far as the quality of the food that you're eating. And then plenty of, vegetables, broccoli, carrots, greens. You can eat potatoes. I would pick the sweet potatoes over the, the regular potatoes, because again, more complex. And then fruit, and then typically berries have less of the glycemic index, so they're less of the ability to raise your blood sugar super high and drop them down. But you can eat fruit. I'd rather have you eat apples and bananas than eat candy and chocolate and things like that. So I think those, the fruit takes longer to digest and has more fiber in it, which you need, and it sustains your blood sugars longer. So and if you're gonna, like I always tell the kids, if you're gonna go to a birthday party, they're gonna go to a birthday party and they have everybody's having a piece of cake. They can have a piece of cake. They just need to take their insulin for it. And the same thing for type 2. I mean, you take your medication. If you're gonna have a piece of cake, have a really small, have a smaller piece, not really small, but a really smaller piece. Yeah, and enjoy, but don't build it into your meal plan if you can. So the trick is to plan ahead.
Wow, you said a lot. You dropped a lot of gems, and I wanted to highlight a few things you mentioned. And this debate or discussion happens quite a bit, where grapes are sweet, oranges are sweet, but they're complex carbs. Your body knows what to do with them and will
Mhm.
break them down over time, as opposed to I just had one piece of candy over, or even a slice of white bread, which is not sweet in taste, but can raise your sugar significantly. Um,
Right.
I love the fact that you emphasize meal planning, planning ahead of time. You know where you're going. Talking with a
Mhm.
nutritionist and having a meal plan so you know where, and little spurts of sweets that you enjoy, things you want to indulge in that you can within reason.
Correct.
I love that. Now, Doc, that leads to my next question. What's the big deal? I don't feel bad. I mean, yeah, I feel a little tired sometimes. Yes, my energy is low, but my sugars are high. I don't feel bad. Like, why should I care?
So, I mean, yes, in the short term, you may not feel bad, okay? And that's what we see with, even if you're, not diagnosed or in pre-diabetes, you don't feel bad. But high blood sugars, why do we care about high blood sugars? And why are we always testing for them? And, why is your doctor always worried about your blood sugar and your weight? We're not doing it to be annoying. It's like, I wish I didn't have to talk about blood sugars and weight. I really do. But the reality is that high blood sugars can damage the small arteries in your body over a long period of time. So they can damage nerves in your eyes, they can damage your kidneys, they can damage your heart, they can damage your brain, and your feet over time. And, you know, they can cause you to have a hard time, healing from a cut, or an infection. So if you cut yourself and you're not healing, sometimes we say, you need to test for blood, your blood sugar. If you're a woman, or even a man, you have a high blood sugars, yeast infections. And so they're, really difficult to treat with these high blood sugars, because yeast love to live in warm, moist environments, and, elevated blood sugars really contribute to that, environment. So it's really, it's uncomfortable. It causes long-term damage, and it can lead to early heart disease. And so we really want to focus on getting your blood sugars, below, into the normal range. And we didn't talk about, what the normal range is for blood sugars, but usually I say anything fasting below 100 is normal for your blood sugar. Or if you're going to test your blood sugar randomly at any time of the day, I mean, really we say, anything less than 200, but the reality is less than 140 is really what we were looking for a random blood sugar, um, to make sure you don't have prediabetes. So, over the short term, you may not feel bad. Now, over the, if your blood sugar is over 200, you're going to be thirsty, get dehydrated, drink a lot, pee a lot. And, type 1s, they lose a lot of weight and they can end up in the hospital and be in, what we call acidosis. So it is really important to keep the blood sugars in range. And a lot of patients just feel fine, or they get used to having blood sugars in that high range. And then when they come down to normal, they feel like they're low. And that's not okay either. So you really want to keep your blood sugars in a normal range for, to be healthy and to allow you to be active.
And interestingly, patients start to feel better as the diabetes is controlled.
That's
Yeah.
correct. Yes.
They say,
Yes.
oh, that was what that was. Oh, okay, that makes sense.
Right.
Like I didn't know I was feeling this way. That,
Right. Exactly.
Now, Doc, I have a question from someone who's asking, hi, Ms. Unika. She asked, thoughts on keto diet and intermittent fasting on diabetes and weight gain loss. So someone who wants to be on a keto diet and consider intermittent fasting and diabetic, what do you, general words of caution for them?
Yeah, so, I worry a little bit about intermittent fasting just because I want to make sure that you're not going low, or you're not having, the opposite effect where your blood sugars are higher later on. So I'm not opposed to it. I think the trick is to make sure you test your blood sugars and see how your body responds to it. So for intermittent fasting, a lot of people now have the continuous glucose monitors. So where they wear it on their, on their bodies, and they can either scan their blood sugars or see what the blood sugars are on their phone. And so if you're looking at your blood sugars and your blood sugars are in range, you're not being too low, and over time, over the rest of the day, your blood sugars are in range, I'm not opposed to it.
Okay.
I think, maybe working with a professional to kind of help guide you in the beginning, at least, is always helpful for that, and see what your goals are. I have seen people who gain weight with intermittent fasting, and not, even if they don't have diabetes, they gain weight because they tend to eat a little bit more later on because they're hungry. And there's a lot of hormonal factors involved. And so I think, I've seen people who have great results with intermittent fasting and diabetes, and people who don't. And so I think, we need to just test and be actively aware of what's going on in our bodies. The keto diet, so again, in the past, we used to always, you know, I'm a pediatric endocrinologist, so I used to always tell kids that they need to have carbs to grow. Okay,
Right.
like you need to have carbs to grow. You can't just do protein and not grow. Um, and then, you know, this is what I love about my patients. They prove me wrong. Like some of my patients will, you know, I had a 4-year-old who's, you know, we always used to tell them, count your carbs, take your insulin, and you're not going to grow. And then the parents were professors at one of the universities nearby, and they had done all their own research, and so they ended up doing a lot of things for their child who's 4 with I guess a pseudo keto type of diet. So for example, in their daycare, the child would get, you know, every Friday was pizza day. And they were so frustrated that the blood sugars would, you know, the pizza would cause such high blood sugars that were sustained over time. So they went to a Mom's Organic Market and they bought like, and I didn't even know this, there's like a pizza that you can buy that's made of chicken crust. And so it's made of like, you know, chicken breast, and it doesn't have carbs in it. You know, other than, I think they had, you know, some cheese and you know, whatever's in the cheese and the sauce, and very low in carbs. And they were giving him food like that. So most of it was low carb, not 100% just keto, not just meat and, you know, veggies, but he was getting some carbs. So it was probably like 10 to 15 grams per meal, which is pretty low for a child. And he was growing fine. He ended up growing fine. And so I guess, you know, the moral of the story is they were testing blood sugars a lot. They were coming in to see me every 3 months. We were keeping an eye on it to make sure his growth and development was normal, and it was. And so we said, okay, that's okay to do that. And his blood sugars were perfect. His A1C was like 5.5, and he had type 1 diabetes. And so, I think the answer to that question is you can do it, and you can really do. I really want to empower patients to do what they want to do, but you have to test and you know, like experiment with it and see what works.
See if it works for you, and do
See
that.
if it works, right? Right.
Yeah.
There is no universal plan. I mean, there's nothing I could say. All diabetics, everybody with diabetes, go on keto. Like that's not going to work for everybody.
Right. Right. Thank you. Thank you.
Sure.
Next question. What is an A1C? People hear that all the time. A1C is good, bad. Well, doc, I don't. What is it?
Yes. So hemoglobin A1C, it's called A1C, hemoglobin A1C, glycosylated, you know, hemoglobin. So an A1C is a common blood sugar test that's used to diagnose type 1 and type 2 diabetes, and even prediabetes. If you're living with diabetes, it's usually used to monitor your blood sugar levels over a 3-month period of time. Okay. So what it is, it reflects your average blood sugar over the past 3 months. And you know what happens in your body is you have red blood cells. Everybody has red blood cells, and the red blood cells get coated with sugar, and that's what they're glycated, and so they're coated with sugar over time. And the hemoglobin is, you know, the cell that transports oxygen throughout your bloodstream. And once it gets blood sugar or glycosylation on it, we can measure it and say, what is your A1C? And the higher your A1C is, the higher percentage of your red blood cells have glucose attached to them. And you do not want to have a lot of your blood cells have glucose attached to them because it can cause damage. So, you know, these red blood cells go through all your small nerves. They go through the nerves in your eyes, they go through the nerves in your fingers and in your kidneys, everywhere. And over a long period of time, if the cells in your eyes see high blood sugars with this hemoglobin, you're going to cause damage. So that's why we want to keep that percentage of your blood sugars, the percentage of your red blood cells that have glucose on them, very low. We want to keep that percentage low. And so, you know, that's what we test every 3 months. And it's not like a report card. I mean, I used to have my patients say, like, I don't want to have my, you know, A1C tested because I don't want to know what it is. And it's not a report card. It's not like if you have an A1C of like 10, you're got an F. I mean, that's not what it means. It's a way to say, okay, what percentage over the last 3 months of your blood sugars have sugar on them, and what can we do to decrease that level the next time you come? The next time you come within 3 months, it could be lower. It could be perfectly in range. So it's a tool to use. It's a tool used to see, you know, how you're responding to your diet, your exercise, your stress level. What can we do to change that?
Awesome. It's a tool. I like it. I like your
Yeah.
approach, Doc. You don't make the patients feel guilty. You're like, look, yes, this is what it is. Okay, what can we do? How do we pivot? How do we adjust?
Right.
Uh,
Right. Right.
and I have a comment here. Hi, Dr. Mitra. She says also blood vessels in the eye, leaky blood vessels, diabetes can contribute to that. Of course, well spoken as my doc.
Yes.
As potential complication from untreated, undiagnosed diabetes. So that's another
Right.
reason why that should be managed.
Right.
I have one more question before we wrap up. If it's sugar-free, doc, it says sugar-free on it. Am I good to just, am I good to eat it? I know you alluded to it earlier in the conversations, but I wanted to make sure we kind of highlight that. So it says sugar-free, doc. Am I good? What would you say to that?
Yeah. So
It's a loaded question. It's a loaded
yeah.
question. I know.
So I'm gonna start by saying no. Okay. You can't eat as much as you want of the sugar-free food. And American adults consume 77 grams of sugar a day. That's 3 times more than the recommended amount. And if you eat that much every day, it's the equivalent of a 10-pound bowling ball once a year, right?
It's
So
15,
it's a
15
huge.
tablespoons of sugar. 15
Mhm,
teaspoons of sugar, just for
mhm.
perspective. 15 teaspoons of sugar
Yep,
a day.
yep,
Yeah.
yep. And children in general are taking in about 30 gallons of sugar from beverages alone. So that's like enough to fill up a whole bathtub, right? And so it's huge. And so it's tempting to look at alternative sugars as a magical solution, right? Um, but it comes down to how fast that sugar is absorbed. And there's a lot of claims in at the grocery store about what is, has added sugar, what's sugar free, what's reduced sugar. But when you look at the labels that say reduced sugar, reduced from what, right? So if they're, the regular one has 100 grams of sugar, and reduced one is 80 grams of sugar, is that really a big difference? And it's not. So reduced, from what? And so, it could say no added sugar, which is great, but it already has sugar in it. So you need to look at how much sugar. The sugar-free or sugar substitutes, they can have less sugar, and usually they have to have less than 0.5 grams of sugar per serving. But it doesn't mean that it's good for you. And it also has added carbs. It can have, extra carbs, extra fat in it that you don't need. So it's unregulated, I guess is my point. So it's unregulated. The manufacturers can put in whatever they want. And some of these products that claim that they have low nutrients or sugar-free or low sugar actually have more of something else. So they have added fat in them that you don't need. And so I think it's a good idea to choose the reduced sugar or sugar-free, but you can't, again, eat as much as you want of it. I would just use it in moderation. And sugar-free sweets usually have more calories and fat and carbs in them. Some of them.
Okay. All right. So the whole point of this, and I'm glad we're having this discussion, is to encourage, more thoughtful choices of food, right? Yeah,
Right.
you indulge every so often, but what's best for you, whole grains, real food, natural foods, those are ideal. And at least when you're eating those foods that are not or they're processed, you know what you're eating. You're not tricked
Hmm.
into eating them. And I'm glad that we're having this discussion. You have been so resourceful, Doc. I've learned a lot even listening from you as well. And I'm sure people are wondering, like, this doc, I like her. I know people in the Virginia area, and I would love
Hmm.
to come see her. Doc, where can people connect with you, or how?
Sure. Yeah. So if you have any, other questions or want to join my mailing list, my email is Dr. Mehra, so Dr. and then my last name Mehra at, and then the I don't know if you can put it in the chat.
Yeah.
I can put it in the chat here, Dr. Mehra at themehraclinic.com. I am launching my telemedicine practice next week in Virginia. And for all of you in Texas, I have a Texas license in the works. I don't know how long that's going to take.
It's coming.
I
It's
don't know how long that's going to take. But I have a Texas license that's coming for telemedicine appointments. I have in-person appointments available in Virginia in telemedicine. I offer telemedicine now in Virginia, Maryland, and Texas coming soon. So
awesome.
yeah.
Awesome. Someone asked California. What about California? Are you going to work on that one too? California.
Where?
California.
California? So California is a tough state to get into from out of state. They're very regulated as far as their telemedicine laws.
Yeah.
And so right now I'm not looking at California. No.
Sorry about that. But thanks for asking that question. Great question.
Yes.
But thank you so
Yes.
much for coming, Doc. This was very, very helpful. I appreciate you. And those of you who watch live, thank you for joining us. Of course, caring is sharing. So please share, tag, forward to as many people who could find this useful. And that being said, if you or anyone is looking for an awesome, a thorough, and a passionate family physician here in the Mansfield, Texas area, who helps nudge you make better decisions for living long and well, I am she. Thank you all for watching. Thank you so much, Doc. I appreciate you.
Okay. Thank you so much. Okay, thank you for having me.